Hello, everyone. Welcome back again, everyone, to my YouTube video channel. Today, I want to share with you a couple of trick and tip on how to remove any tube pretty much comfortably. Now, back in the day, we using the typical straight and curve elevator to remove the tube, right? And then your school sometimes don't supply you enough tools for you to do, and you always struggle with taking out tube, especially when you see a long route, when you see pretty much like, let's say you're trying to remove the premolar for orthodontist purpose, and you stress out. Now, there's a couple of ways to remove a virgin tooth. For example, for auto purpose, you can do is simply if let's say if it's extraction for braces purpose, you don't want to remove that tooth right away. You should put braces on the patient, and you remove that. You put braces on every teeth, including the tooth to be removed. 2 or 3 weeks later, the patient come back, the tube is mobile. That's where you numb the patient, and you can take it out. Each of the tubes, you can take it out within 1 minute. It's done. So I guarantee it's gonna be fast and painless for the patient. And those of you being referred by or an orthodontist, and I also suggest you, guy, that thinking about the benefit of the Dow of the general dentist or oral surgeon, yeah, at the surgeon or at the dentist, we can take out any tooth we want to, anytime, any tooth we want to, but it's a matter of how comfortable you want your patient to have after the extraction. So the key thing is to help your patient now by uh, having the patient experience your braces you put on first. Luxate the tube by whitening the PDL, the periodontal ligament, and then you a few weeks, and then when you take it out, it's a lot easy. So I encourage orthodontists or general dentists to think about the best thing for your patient. Now, that being said, is for the virgin tube, like a nice clean tube. But let's say if you want to take out, if you have a tube that is considered a difficult tube, and you need some kind of mobility before you take it out, the traditional way that you use in the elevator, and you also remove a little bit of buccal bone and things like that. And nowadays, there's few way to do. Uh, my traditional way of doing a broken back and bad tube is I actually clean up everything coronally, and then I make in a section, whether it's mesodistal or buccolingual, depend on the situation, how much tooth structure I can see clearly, and then I put the elevator in. It's like screwdriver, and I twist it, and it just come out right out, and it's very very simple. So that's a second way to go for broken tooth down. But also, let's say let you have a case where the tooth still fairly in decent shape, but it needs to be removed. You need some kind of mobility. So yes, you can use a straight elevator, or you can actually using what we call a luxator. I have something in my hand here. You can get this from anywhere in the dental uh, um, supply company. Okay, you can see how sharp this luxator is. This is how it look like. Okay, you can see it. I want to make sure you can see it from this view. See this? Okay, that's the luxator. Okay, I want you to see it. There, let me pull it back. There, better. Can you see it? The luxator. So there is a angle. You see how it angle? Okay, and the other one is straight. This is amazing tool to take out to basically luxate the root before you take it out. It's so easy for your life. You do need to sharpen in this when it get dull, but you see how it's like this, and I'm gonna show you where to find them. So nice and easy for your life. You put some pressure here and hold it, twist slowly, and the tube is luxate. Then you grab the forceps and you can take it out. So again, this is luxator. I just want to show you that it comes into a pack. So I want to see if I can share the screen for you guys, okay? And share you the some video that I see on here. Hang on, okay? Thank you for me an opportunity for me to share the screen. I want to show you this. Okay, so let's share the screen. So this is directly from the company called Director Luxator. So I jump into right into those video. So you can go to the www.directordental.com and search for the video. So let me just show you this right here. Let me go back. You can see how he put his finger. I want you to see this, okay? He put his finger really close to the root, to the tip of the luxator. And the other thing that he talking about is making sure that you are not using the edge of the peritone, or the luxator, but you are putting along the root surface and trying to break the ligament. That's the key. So I want you to see one more time. And you can see the tube is moving because you put pressure along the root. Okay. Once it's loose, you can use the forceps or any tool to remove it. So that's which one I want to make sure you understand that. That's called the Luxator P series. Um, Next is he's gonna. This is important, guy. Again, along the root, guys. And this is a unique tool. It's like a pen. You hold it's like a pen. Come with a set. The good part of this one is It doesn't get dull compared to the other stainless steel material. Very powerful tool. So yeah, it would be nice to get this set. So the next one is Luxator 40 elevator. Beautiful, guys. So as you can see, I just show you the video of the company director. Dental is a company from European country. Uh, they produce amazing oral surgery tool. It's really help you to do get yourself confident. But again, today topic is just how to take out the tube confidently. Most important thing is you have to identify create the mobility. The ligament had to be loosened up before you grab the forceps. Now, a lot of young dentists trying to use your hand and do the work. It's not good. In the long run, it's going to hurt your hand. So it's not how strong you are, but it's just what you need to use your brain and do it confidently, minimally invasive. So I put down a lot of video on my YouTube channel. I hope that you can search, type in how to remove endodontist broken tooth or how to remove a tube, a wisdom tooth. There's a lot of video on my channel. If you want to learn more, subscribe to my channel and follow me. Hope to see you next video. Thank you for watching today, everyone. And I hope that appreciate that those of you who like what I do, please subscribe to my channel and hit the like button or make some comment. I really appreciate it. Have a good Thanksgiving, everyone.